Could my immunosuppressant drugs actually be contributing to my hair loss? Stay tuned. We're going to talk about that today on the Transplant Helper. I want to thank you for joining me today on the Transplant Helper podcast / YouTube video series. My name is Jim Merle, and let me stop and ask you for just a moment. If you've not already subscribed to this channel, how about go ahead and do that? Generally speaking, you find a subscribe button right below this video, or you can also hit the little bitty icon you might see in the very lower right hand corner of the video, and that will allow you to subscribe to this series of videos as well as all the videos I produce on a regular basis. Now, each of the videos that I produce is always surrounded around advocating, educating, and motivating us as transplant patients. So hopefully you'll find that to be the case with tonight's content as well as any other that we're involved in at any time. And if it ever helps you at all, how about like, subscribe, share, and even comment below this video. Now, tonight's discussion, as I said in the teaser, has to do with the question that was asked. Basically, is it possible that our immunosuppressant drugs can cause hair loss? Now, the general answer to that is certainly yes, but I want to read a viewer question I got the other day. Specifically, caused me to want to answer this question. And by the way, this is oftentimes comes up a lot on Facebook groups and different places where transplant people tend to congregate and have discussions because it is a universal problem. Let me tell you what the viewer said right here on my phone screen. I'll just read it as it says. Has anyone dealt with hair loss from Prograf? I had my second kidney transplant 5 months ago, and my hair is becoming very thin. It's been falling out rapidly for the past 3 months, in spite of the fact that my doctors changed me over to Cyclosporine a month ago. It's still coming out like crazy. Is there anything I can do to stop the shedding, as they put it there in the end of that? Well, to answer that question in general, Prograf is oftentimes connected to hair loss, but I want you to also understand that it's not always a direct connection. That's something we need to keep in mind as transplant patients. There are many side effects that oftentimes go along with all of our drugs, especially the immunosuppressant drugs, things like Prograf. Tacrolimus is another name for it. The viewer here talks about Cyclosporine, which is in the same category as those. Our myfortics or mycophenylates, those types of immunosuppressant drugs do come with a lot of symptoms. And in this case, being Prograf and Cyclosporine, yes, both of them can cause hair loss, albeit it's not always in a direct connective state. Now, what I mean by that is oftentimes these immunosuppressant drugs seemingly cause a symptom that if you'll do your homework on that and do your research, it's not a direct symptom of that drug. Now, here's what I mean by that. You may not understand that yet. Basically speaking, a lot of times with any symptom, those things can be caused by vitamin deficiencies. For example, in the case of hair loss, vitamin deficiencies as far as vitamin A, vitamin B6, vitamin B12, vitamin D, vitamin C, biotin, beta-carotene, and so many more oftentimes can cause hair loss themselves. Whether you're on Prograf or Cyclosporine or any other drug for the matter, if you have deficiencies in those areas or in those vitamins themselves, you can oftentimes suffer from hair loss. And I think that has something to do sometimes with why even we as transplant patients likewise, have that thinning top or those receding hairlines or maybe just hair falling out, as this viewer complains about experiencing. Now, the way that connects is Prograf, and I'll use it for example because it's so universal among all of us as transplant patients. Prograf doesn't always necessarily cause the hair loss itself. You see, what really happens if you do your homework is that Prograf actually changes the makeup of our bodies enough to cause some of the vitamins that our body generally produces and or absorbs properly to become less less likely to be absorbed. We'll just say it that way before I make up a word. But nonetheless, you see, taking Prograf might lower some of these vitamins in your body. The vitamin A, the vitamin B6, vitamin 12, the calcium levels are oftentimes involved, as well as the vitamin D and the magnesium. So it may be that you're taking a Prograf Tacrolimus, Cyclosporine, some of these other drugs, is not directly causing your hair loss. However, it is causing you to be deficient in some of those vitamins. I'm going to have another program coming up really soon where I talk about vitamins and how important they are. But basically, I want to encourage you right now, if you're suffering any symptoms at all from your medications, including this question that's asked concerning hair loss, I would encourage you to go and see your doctor. Again, I'm not a medical doctor. I'm not even related to a medical doctor for that matter. So I'm only giving you my advice from someone who's been there and currently doing that. And I say that a lot of times on this program, but I would encourage you to go and see your doctor. Report the hair loss or whatever side effects are going along with that drug, and then ask them, if you have to, ask them to do a full blood panel. And after that point, sit down with them and ask them again, can you go over this blood panel, these blood results line by line? Because you're curious as to whether or not you may be deficient in some of these areas. And if you find out there is a deficiency, then ask them if they can possibly help with that. Maybe there's some drugs they can prescribe you, vitamin type drugs, supplements that can supply that need and bring those levels up. Iron is one that's always a problem for transplant patients. Magnesium deficiencies, vitamin D deficiencies. These can oftentimes be common deficiencies among us as transplant patients. Again, not directly as a result of our transplant, but oftentimes directly resulting from some of the medications we're on. Now, I had someone the other day, I made that suggestion on one of these Facebook groups, and they turned and said, really? The doctor can actually sit down and discuss your blood work with you? Yes. And again, I would encourage you to basically force their hand on that and ask them, again, go down line by line, see if I'm deficient in any areas. Now, another thing you can do for yourself, and this is what many of the people who are on the discussion board I saw the other day concerning Prograf and hair loss were speaking of, and it is one of those vitamins that we can be deficient in, and that is basically biotin. At least that's the way that I say it. Maybe you can see it right here on the screen. But biotin, again, is kind of a vitamin B type drug, but it does even say on the bottles right here, and I think some of this is actually proven that it does help with hair, skin, and healthy nails. And so sometimes women particularly will take this anyway just because they've heard that it maybe hardens their nails or something and helps in these areas. Well, I have found in my research that actually it does if, again, you're deficient in that area. And I'm also being told by many who've kind of been there and done that also that it does work if it's taken in a high enough dosage. But again, as I always say about any medication, whether it's vitamins, supplements, that type of thing, or really just any medicine, pain medications or whatever, please, 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 and I'm going to take an entire program to talk about this likewise, don't just go out and self-subscribe or prescribe, not subscribe. Subscribe to the channel while we're talking about it, but don't go out and self-prescribe your own medicines. Let your doctor do that. That's what they're getting paid for. That's what they're good at. So don't just go out and say, well, I saw a program on YouTube where a man told me that biotin might help, or vitamin A, B, D, magnesium, that might help with my symptom of hair loss and Prograf. I'm telling you that may be the case, but I'm also reminding you to go and ask your doctor. Let them do that, because if you go out and take supplements all on your own, that within itself can start messing with some of those levels, particularly things like your the thickness of your blood, and especially if you're on any kind of blood thinner or I'm trying to think, I just went blank, but other drugs out there, whatever, but it can actually change those levels within itself. So don't just go self-prescribe those things. I have to pause to say that, but don't go and self-prescribe any vitamin to yourself, but ask your doctor. So what am I saying here? Yes, Prograf can be in a way connected to hair loss. Number two, it's oftentimes through a vitamin deficiency caused by the Prograf. Number three, that you need to have a full blood panel done and consult your doctor if you're having any symptoms, see if there's some deficiencies. And then number four, let them help you to know what to take. Let them guide you in that. I hope this program has been some help to you. I know that the people I see on these different group pages, they're concerned. And again, this viewer was certainly concerned enough to stop and ask me the question. So here's your answer. Basically, yes, but let your doctor help you to fix that problem. Now, if this program or any other programs that I've produced over time has helped you in any way, how about like, subscribe, and share? and make these videos known to others among you. You probably know someone, if you're around the transplant world, who could benefit from these videos. So how about share them with them and help them to find this as we work together again to advocate, educate, and motivate one another as transplant patients. Also, I want to ask you to comment below. Are you dealing with hair loss, coinciding with Prograf or any other drug? What kind of symptoms are you having from Prograf particularly? How about comment below? If you're not able to do that, hit me up on my website, thetransplanthelper.com. Hit that comment button there and connect with me, and I'll be happy to hear your discussion and what you're dealing with. In addition to that, I'm always available on Twitter at transplant_help. Again, thank you so much for joining me. Subscribe, like, and share. And until next time, stay stronger, friends. So we can work together, advocating, educating, and motivating. That's what we want to do. Again, stay stronger, friends.